The ellas: Pasteurella, Franciella, Bordetella, Gardnerella, Legionella, Kingella, and Eikenella. For just some general characteristics, these organisms are found in natural habitats such as soil, water, and in animals. They are also part of normal flora in the human urogenital and oropharyngeal tracts. They often originate from animal sources. For clinical relevance, these are relatively rare isolates in human infections, but they can include genres such as Pasteurella, Franciella, Bordetella, Gardnerella, and Legionella. Pasteurella is actually normal flora of the respiratory tract and gastrointestinal tract of dogs and cats. This is a facultative anaerobic organism. Recovery will be from an animal bite wound or scratch that results in an abscess and cellulitis to the patient. And the wounds are typically very purulent, pussy. You get a lot of drainage and discharge from these. Most frequently, the organism will be identified as Pasteurella multicida. Pasteurella is a gram-negative coccobacillus. It does grow on blood and chocolate, but it will not grow on MacConkey. So that may help you with a gram-negative for its determination. So it's not a gram-negative rod as in an Enterobacteriaceae or a non-glucose fermenter, but a gram-negative coccobacillus. Hopefully you have patient information that will indicate if this is from an animal bite wound. It is a small non-hemolytic grayish or brownish growth. We will generally have discoloration on the media, and you will also notice like a musty kind of foul type odor from it as well. It will show positive for glucose fermentation, which is a presumptive identification is going to be based on no growth on the MacConkey, a positive oxidase, a positive spot indole, and with the patient history of an animal bite or scratch. Pasteurella is typically treated with penicillin. Franciella is a resident flora of animals, commonly contracted in humans from the exposure to rabbits, squirrels, beaver, and deer. It's common in individuals who handle animal carcasses or skins. Infections due to Franciella increase during hunting season, once again due to people handling those types of things, skinning of rabbits and carcasses, things like that. Rates of transmission actually include inhalation, direct contact, or an animal bite. And I'm not sure why, but I always think in my head for some reason that Francis would be a super cute name for a bunny. So that's kind of how I remember Franciella and Francis with bunny bites. Franciella tularensis causes tularemia. Specimens will include aspiration or exudate from an infected tissue or lymph node. Franciella needs to be worked at a biosafety level 3, which you may or may not have depending on where you're working at. So hopefully you have some additional information from the patient and physician so you're not working these up in the open. Franciella is a tiny gram-negative coccobacillus. Franciella does require cysteine for growth. So again, if you need a special request from your provider, typically you'll use buffered charcoal yeast extract agar, so that BCYE agar. It's an obligate aerobe. It is oxidase negative. Most of the time it's identified through serologic agglutination or direct fluorescent staining from direct smears. The drug of choice for Franciella infections is streptomycin. Bordetella is also a tiny gram-negative coccobacillus. Bordetella pertussis causes whooping cough that's contracted by inhalation of cough droplets from an infected person. The P in the DPT vaccine does stand for pertussis, so most individuals have had immunizations against this. And at this time, we don't see too many cases, though on the news you have heard of some outbreaks due to non-compliance with vaccination. Transport media at half strength, known as Regan low agar. You may need to counterstain for 2 minutes with your saffron or actually use carbofusion as your counterstain since it does not stain well with the regular procedure. Bordetella pertussis is an obligate aerobe. Colonies will often look like pearls or mercury droplets. Identification can be done by fluorescent antibody stain of a nasopharyngeal smear that uses a fluorescent labeled rabbit anti-pertussis antibody. So again, not often cultured, but you do need to know about the transport augers mentioned earlier and the plated augers as well if you're going to be doing a traditional culture. For treatment, erythromycin is typically the drug of choice. Gardnerella vaginalis is a pleomorphic gram-negative or gram-variable coccobacilla. Normal flora of the vaginal tract of 40 to 60% of women. The organism adheres to epithelial cells, so oftentimes a vaginal wet mount will come from the patient, and what we will see is something called clue cells or glitter cells. So you probably learned about this, I would think, probably in urinalysis, but just for a review, you can see the picture up there, what your normal epithelial would look like versus what a clue cell or glitter cell would look like. Gardnerella is sexually transmitted, and it can cause bacterial vaginosis. Patients that have this will present with a thin, milky white vaginal discharge, typically with a foul odor. You may have a specimen that's 20% clue cells, a vaginal pH of 4.7. Sometimes you'll get like that amine type of odor, and physicians will refer to those in the vaginal discharge as diagnostic, so they won't really even need to do any testing or culture for this because they have everything they need from the initial looking at it. Some clinical complications from Gardnerella vaginalis is it can cause postpartum bacteremia, endometriosis, premature labor, or neonatal septicemia. For culture media we're going to use HBT agar or human blood tween agar and V agar. For culture media for Gardnerella vaginalis, like I mentioned earlier, we're going to do the human blood tween agar. This is composed of an enriched medium containing human blood, tween 80, which is a detergent, and nutrients to support the growth of Gardnerella vaginalis. For the purpose, it is a selective medium designed to enhance the growth of Gardnerella vaginalis while inhibiting contaminants. For the appearance of the colonies, so they're going to be tiny pinpoint colonies that may show slight beta hemolysis, which is that clear zone around the colonies due to the lysis of the red blood cells. On V agar, so this is a composition of a specialized medium enriched with nutrients favorable, again, for Gardnerella vaginalis. It's often used in clinical labs to cultivate fastidious vaginal flora. For characteristics, it's going to support small, pinpoint, slightly beta hemolytic colonies, which is going to be similar to your HBT agar. The importance, so Gardnerella vaginalis is a fastidious and often difficult to culture on standard media like blood agar. So use of these selective enriched media can increase the chance of isolating Gardnerella vaginalis from clinical specimens. As mentioned, those colonies appear as tiny pinpoint with slight beta hemolysis. For diagnosis of bacterial vaginosis, this is best diagnosed by a wet mount preparation or a wet prep of vaginal discharge. The detection of clue cells and other clinical signs on the wet prep is actually diagnosis or key for the bacterial vaginosis diagnosis. In cases of postpartum bacteremia or neonatal septicemia, we can directly culture blood specimens onto plates. We're going to avoid using the SPS or the sodium polyethynyl sulfonate containing media, as SPS can inhibit the growth of Gardnerella vaginalis. Proper culture techniques are critical for accurate detection in bloodstream infections. For antimicrobial susceptibility testament and treatment, so metronidazole is the universal treatment of choice for Gardnerella vaginalis infections, especially bacterial vaginosis. It is effective against anaerobic and facultative bacteria involved in these infections. Legionella. This organism was named from the initial outbreak of pneumonia at an American Legion convention. Legionella pneumophilia is the most common isolate found. It is a natural inhabitant of lakes, streams, and ponds. And Legionella can also be recovered from shower heads in whirlpools, like in hotels. 10 to 30% of nosocomial pneumonias are actually caused by Legionella. So the pneumonic form is known as Legionnaire's disease, where the flu-like form is known as Pontiac fever. Your specimen of choice is that transtracheal aspirate or bronchial washing. Growth will be a tiny, thin, gram-negative bacillus on a gram stain, and you may need to do a modified counter stain depending if it decides to stain that way well or not that day. We typically don't identify Legionella based on culture because it is difficult to grow. However, if you are doing a traditional culture, the media needs to contain cysteine and iron, so your media choices are going to be that buffered charcoal yeast extract. Diagnosis for Legionella is usually done by a direct fluorescent antibody stain or a serologic antibody titer. For the titer, we're going to be looking for a 4-fold increase or greater than a 1 to 128 on the antibody titer. For treatment, it's going to be erythromycin and rifampin are generally going to be your drugs of choice. So we also have Kingella kingae and Kingella dentatrifficans. These are normal flora that are commonly found in the human oral cavity. For clinical significance, they can cause bacteremia and endocarditis. They are noted for their affinity for bone and cardiac tissue. Kingella kingae is the most common isolate from joint fluid, blood cultures, and skin drainage. For culture characteristics, they're going to grow on blood agar and chocolate agar. The colonies will appear after about 3 to 5 days of incubation in carbon dioxide. These colonies are small, grayish, and beta hemolytic. Kingella dentatrifficans grows on modified Thayer-Martin agar. It is oxidase positive and glucose fermentative positive as well. So how do we differentiate this from Neisseria? So both Kingella and Neisseria are both oxidase positive and ferment glucose, so they can appear very similar. So the modified Thayer-Martin agar, the purpose is it is a selective medium designed primarily to isolate Neisseria gonorrhea and Neisseria meningitidis from clinical specimens. The composition is it is enriched with chocolate agar base, providing nutrients, which contains antibiotics such as vancomycin, which inhibits gram-positive bacteria, colistin, which inhibits most gram-negative bacteria except for Neisseria and Kingella, nystatin, which inhibits fungi, and trimethoprim, which inhibits Proteus species. So the relevance for Kingella, so Kingella dentatrifficans can grow on the modified Thayer-Martin agar despite its selective nature, which may cause confusion with the Neisseria species. As mentioned before, they are oxidase positive, which indicates the presence of cytochrome C oxidase enzyme used in electron transport during the aerobic respiration. For glucose fermentation, they are also positive, so they're able to ferment glucose producing acid detected by pH indicator changes in test media. For nitrate reduction positive, so Kingella dentatrifficans can reduce nitrate to nitrite or further products, which can differentiate it from Neisseria species, which are nitrate negative. Eikenella corridans, this is a normal flora which is part of the human mouth. It is associated with wounds from human bites or fist fights. For morphology, they are tiny gram-negative bacillus. In culture characteristics, they require an increased carbon dioxide for optimal growth, and it grows on blood agar and chocolate agar and produces a pale yellow pigment. 40 to 50% of the isolates will pit or corrode the agar surface that will create small depressions in the agar.